You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he said nobody should be wearing a loose-fitting denture. We've had him on the program before, Dr. Christian Yaste. Dr. Yaste, welcome to the program.
Great to be back, Randy.
All right, now you brought a lot of photos, so we'll try to get to as many of those as possible. Now, for people that don't know your practice, who's the typical patient that's coming in for dental implants?
Well, we have a very large practice. So we have 28 people that work for us. We have 3 doctors. We have 4 dental hygienists, but it's an adult practice. So we focus on a couple different things in our practice. We focus on people that have broken, missing teeth. Dental implants is big for us. Also people that are afraid of going to the dentist. So sedation dentistry is big. And then people don't like their smiles, cosmetic dentistry. So back to your original question, who's a typical dental implant patient? So there's really two different types of patients. There's patients that wear dentures. They have no teeth and they want something different. And then I've got these patients that come in and they don't know what's going on, but they know there's something that's not right and they're headed to maybe dentures. They have gum disease, they have bad breath.
So they want to avoid dentures.
They want to avoid dentures at all costs.
So back to the denture wear, where you are there a lot of people wearing dentures?
So I'm in Charlotte, North Carolina, and you may have heard of the Carolina Panthers. Okay, that's our professional football team. The stadium, I think, fits 75,000 people, something like that. Randy, I could fill that entire stadium with people that are either wearing dentures, don't have teeth, have broken teeth, have infected teeth, have teeth that are loose, or that hate their smile over and over and over again. I could fill that stadium.
So if it's so good, then why is everybody doing it? Like if implants are so good, getting your teeth back?
There's a couple reasons.
All right.
So the first reason that people don't come in and get their teeth looked at or get taken care of is denture wearers. Let's take them. Okay, so they don't go to the dentist, Randy. They don't have teeth.
Good point. All right.
So if they don't go to the dentist, they don't know what options they have.
All right. And
some of our patients haven't been to the dentist for years. Let me tell you a story about this guy. He hadn't been to the dentist for 50 years. So he was in the Army, got out of the Army when he was 30. He had a bad experience at the dentist, didn't go back. 50 years. He comes into our practice, he says, you know, I'm not having any pain, I don't have any problems, but I'm wondering, like, my buddies are starting to wear dentures. I don't want to wear dentures, so can you help me with this? And I'm like, sure, I'll take a look. So he opens his mouth up. I couldn't see his teeth, Randy. He had just a big block of yellow in there. All the tartar and all the stuff that had built up. I honestly don't think he owned a toothbrush. So we get him into the practice, we chip all that stuff off. And underneath, guess what we find?
What's that?
Beautiful set of teeth. Nothing wrong. No gum disease, little inflammation in the gum, no cavities, nothing. And he's 80 years old. Then I have other people in our practice. I'll give you an example of somebody that's I'm related to this person. I cannot tell you who it is, okay? She's 30 years old. She brushes and flosses every day. She takes great care of her teeth, always went to the dentist. She is diagnosed with gum disease. The number one reason people lose their teeth, periodontal disease. So she's diagnosed with that, and she's heartbroken. And she says, I can't lose my teeth. I can't lose these teeth. What am I gonna do? It takes us 10 years to help her to finally get this gum disease under control. So she's gonna keep her teeth. But why is it that some people, they have great teeth, they don't take care of them, or they don't have, you know, they're just not doing anything with their teeth. And then these other people that really try hard and they can't seem to get anywhere. And the reason is because it's genetic. So I don't know if you know this, but have you ever been told, like, if you don't go to the dentist, your teeth are gonna fall out, or you're gonna have problems? Okay, so how do you explain the guy that didn't go to the dentist for 50 years? Why didn't his teeth fall out? Why didn't he have problems?
So some people just lose their teeth with this bacterial infection.
Yes, and the thing is that you don't know if you're gonna lose your teeth or not. That's why it's really important to go to the dentist to find out. So if you don't go to the dentist, you're not gonna know. But if you do, at least we can find out if we can help you or not. But let's talk about why do people not get dental implants? Why doesn't everybody get dental implants, right?
Yeah.
So the one reason is they don't get dental implants because they don't know. And let me tell you why they don't know. That leads into the second reason why people don't go this route, is they hate the dentist. They've had horrible experiences at the dentist.
We're talking about the denture wearers.
Well, yeah, but even
Okay.
people that don't wear dentures, that have teeth, that their teeth are all just rotted out, or they've had so many miserable experiences at the dentist. They started going to the dentist when they were 5 years old, and every time they went in, it's a cavity. Every time they went in, something wrong, or a tooth had to come out, or something like that. Now, you've got this person who's a complete dental, we call him a dental phobic, really unhappy with their teeth. And every time they go into the dentist, it's miserable. And they finally get to the point, Randy, where they go, I'm just going to throw the towel in here. I'm done. I don't want my teeth anymore. And unfortunately, a lot of these people go somewhere where all they do is dentures, or the dentist says, I think you just need to get your teeth out. Yeah. And 20 years ago, that's super, super common for that to happen. So all the teeth come out. And now we're back to the first reason. They don't go because they don't have teeth. And the thing that's keeping them from going is they've had such horrible experiences.
So it's tough to get those people back in. Once they're in a denture, last thing they want to do is see you?
Absolutely. But these are the people that we want to get in. We can help these people. So another reason that people don't come in to find out about dental implants, they think they're too old.
How old can you be to get this done?
As old as you want to be. I have people that are 18 years old that get dental implants, and we have put implants in people that are 90 years old. You can have implants.
Why would a 90-year-old want to do this?
They want teeth again, because you can't put a price on teeth. You can't put a price on chewing the foods that you love and enjoying it, and being able to not be embarrassed about your smile, to be able to interact with your grandkids or your kids and be happy. There's a young man, he's about 35 years old, and he comes into my practice and he hates his smile. He hates it. He can't chew good. He doesn't have back teeth. So he spends an enormous amount of money to get his teeth fixed with me. And he's a new guy, man. I mean, this guy looks fantastic, and he's super happy that he did this. He managed a big restaurant. 6 months later, he died in his sleep. He had sleep apnea. He died, and his wife invited me to the funeral. Well, I was worried, Randy. I'm thinking, I wonder if she's upset because he spent all this money, and he only lived for 6 months after that day. I get to the funeral, and I'm worried, and she comes up to me and she says, I'm so glad that you could come to his funeral. And I'm like, I'm so sorry to hear about this. I mean, what a shame. This poor guy, he's young, he's vibrant, he dies in his sleep because of sleep apnea, which is a whole nother problem. But she said, you know what? I hope you're not upset that, he's died, or because of the money we spent. She said, the last 6 months of his life has been so much better. In fact, he told her, he said, no matter how much it cost, he got his life back. He was interacting with his children. He was interacting with his wife. He had not been intimate with his wife for years. And then all of a sudden, he had the self-confidence to be intimate with his wife again. I mean, it was so touching. Even though he only lived 6 months, it was so worth it for him. And she was so happy that he had done it too. Randy, when you can give somebody their smile back, it is life-changing. I want to give you a couple examples.
Okay.
I brought some pictures.
All right.
Okay? So this young lady right here, she's from probably 300 miles from my practice. Her sister lives in Charlotte, so she heard about us, and she brought this lady in. She brought her sister in, and she says, you have to help my sister. She won't smile. She's not happy. We trust you. Please, can you help her? So she's headed for dentures, okay? Her teeth were loose. She had gum disease. She was missing back teeth, so she couldn't chew. And her front teeth, they're not her. She doesn't like her front teeth.
Okay.
She's not comfortable smiling and interacting or anything like that with family. So with her, what we did was we placed dental implants, and we removed her teeth. We give her a whole new set of teeth that don't come in or out. They stay in all the time.
That's got to be unusual, teeth like this.
Well, it might be unusual for you, Randy, because you're not a dentist. So you don't see these patients because they don't smile. When they go out in public, they talk like this, and they laugh like this. And when they're interacting with you, they're like this. They talk so that they don't show their teeth. So you never get to see their smiles. But when they come and see us, sometimes they won't even smile for us, Randy.
Right?
I can't, it's like pulling teeth, no pun intended, to try to get someone that is really unhappy with their smile, just to smile for a photograph. They don't use these muscles anymore. So these muscles, they stop working. We have to retrain them how to smile. So once we fix their teeth, we're like, but then it comes natural. In a very short period of time, now this lady, look at her, how her muscles are working to make her smile. It's unbelievable. So when she gets her final set of teeth, she can eat just about anything she wants. Anything that a normal person, so Randy, what do you like to eat?
Well, I like broccoli and vegetables.
Okay, so she can eat that. She can eat salad,
chicken,
cucumbers, corn on the cob, steak, ribs. Anything she wants, she can now eat. You know what, Randy, when people see their smile for the first time after they have a procedure like this, it is transformational. I had a lady not too long ago. She's 85 years old. She came into the practice. She was just like this. She had bad teeth. Her husband had recently passed away. She felt horrible about her teeth and she couldn't eat. She came in and we had this procedure done. So she had all her teeth removed in one visit, and then at the same time, so in 5 hours, her life was transformed. Her smile completely transformed. She came up out of the anesthesia, and when they're in our practice, we like to hand them a mirror. We like to hand people a mirror. It's a really important moment, not just for our patients, but for us as a team.
Okay.
She looked in the mirror, and a tear came to her eye, and then she looked at me and she said, "It's me again."
Wow.
It goes back to what she remembers herself. When she was a young woman, she saw herself again in that mirror. So here's another guy, this fella. Super nice guy, okay? He had a basketball accident. He got hit in the mouth, and he already had some issues with his teeth, but now all his front teeth are loose. Now he has to wear a wire across all of his teeth or they won't stay in. So we couldn't save his teeth. And one of his options is a denture. No way. This guy is my age. He's not going to end up wearing a denture. I'm not going to let it happen.
Okay.
So this is what we do. We go in and we remove all the teeth and we put dental implants in and get him a full set of teeth that stay in. He can't remove them, so they don't come in or out. We can take them out, but he can't take them out. And this is him afterwards. Totally different.
Nice.
Transformational.
So these are upper and lower teeth supported by implants that don't come out.
They do not.
So you're a dentist. You probably think that the smile is the most important thing. How important is it?
It's very important, Randy.
Okay.
So there's, no matter how old you are, no matter how much money you have, no matter what race you are, we all have this thing. The lower half of our face, there's three things that people want from that.
Okay.
Number one, they want to be healthy. They don't want infection. They don't want bad breath. They don't want, most people want to be healthy, right? But more importantly, there's two other things. They want to be able to eat. Chewing, super important. You love to eat, right?
Yeah.
We all love to eat. You go to a nursing home. What is the time of day that's the most exciting at the nursing home? Do you know?
Dinner time.
Dinner time. That's when these people get to go out there and they get to break the monotony and do something they enjoy, which is eating. Super important. So being able to eat the foods that you love is very important. I see myself sometimes as being, my partner and the people in our practice, as being able to help people get their life back because they come in and they tell us, you know what, I was able to go to my grandkids' wedding and I got to smile in all the pictures. Nice. Or I got to interact with my wife for the first time in 10 years. We're close again. We have that intimacy again. I mean, it's a huge game changer for people, Randy. Not for everybody, but for people that don't have teeth or that don't have a nice smile. It's amazing how debilitating, how disabling that can be for them.
My name is Marjorie Newhook. When I was 16, I was in a car accident and I lost the forefront teeth. My remaining teeth just seemed to always give me problems, so my dentist took the rest of the top out when I was 25, and I've had a denture ever since then. I've never been one to smile because I wasn't happy with my teeth.
So in Marjorie's case, what we did was we removed her remaining teeth and we placed dental implants. So when she left, she actually had her teeth in her mouth.
The procedure has changed my life because it gives me more confidence in my smile and my speech. Beautiful smile, you bright up the room, so now I can smile and not cover my mouth.
So let me show you another patient, Randy.
All right.
Okay, this is a great guy. This guy is one of the friendliest guys you'd ever want to meet. He has an important job, but he had he was totally unhappy with his smile. He was fed up, and he hated going to the dentist. He'd had bad experiences his whole life with the dentist, and he was fed up. He was wearing something that comes in and comes out, flips in and flips out. He was sick of it. He couldn't eat what he wanted to, and he couldn't smile. So those teeth that you're looking at, there was no way he was gonna keep them, but he didn't want to go into dentures. No way. So what you're looking at in the second photograph is the process he went through was dental implants and a new fixed set of teeth in 5 hours. 5 hours, he had those teeth.
So how soon can they eat when it's all done?
Randy, they can eat immediately after they get the procedure done. Now, they may not be able to eat all the foods that they want to eat right away because we have to be careful that you've got a brand new set of teeth and the muscles and everything need to get used to it. But all of a sudden now it doesn't hurt to eat. So before you know it, they're eating whatever they want. Corn on the cob, steak, chicken off the bone, you name it.
Do you hear
Nuts.
eating stories a lot?
Oh, yeah.
If you do, they want to come in and tell you?
Oh, listen, Randy, that's one of the biggest things is people want to be able to eat the food that they love eating. They've gone from eating everything they want. They go to the restaurant. What do you order when you go to the restaurant? You order whatever you want, right, Randy?
All right.
Okay. These people that don't have teeth or have teeth that are loose or can't chew, they go to the restaurant. You know what they order? They order mashed potatoes and maybe grits, or they maybe order something they don't have to chew, because they know if they have the steak, they're going to sit there. It's going to take too long. They're going to have to go and be careful.
So
they're going to make a mess.
Chew whatever they want now, like chewy things, like pizza or whatever.
When this is healed, they can eat anything they want. Nuts, you name it, they can eat it.
Okay.
Here's another gentleman.
All right.
This happens to a lot of people, Randy. They lose their back teeth. They have their front teeth, but then they lose their back teeth. The back teeth are what we chew with. The back teeth are super important. If you lose the back teeth and then you only have the front teeth, you go from chewing like a cow, which is the way we're supposed to chewing like a rabbit. And when you chew like a rabbit, your front teeth start to do this. They start to splay forward and gaps in the teeth. So if somebody's watching the show and they say, I didn't have gaps in my teeth before, now I have. If you don't have back teeth, that's what happens, is the teeth start to move. Right. So he didn't have teeth in the back. He couldn't chew. And, I don't know if he was just concerned about his smile, but once you give somebody their smile back, Randy, it's amazing. Now all of a sudden, what wasn't as important to them, oh my gosh, look at these teeth. They go around, they're smiling at everybody. Their spouse comes in and they're
like a guy like this comes in just wants to eat. He doesn't care about the looks.
Yeah.
They end up liking the looks better.
Yeah. Their wife is like, you got to tell him to stop smiling. He's blinding me with these teeth all the time. So with this gentleman, we couldn't really save the teeth and give him back teeth. So we removed all the teeth, and then we placed dental implants, and then we give him a fixed set of teeth. Again, in a few hours, he went from what you see in the before picture to what you see in the after picture, and those are temporaries too. Again, this is a set of temporary teeth, but he looks like a totally different guy.
Yeah,
and now he can eat.
These
do not come out, Randy.
Okay. Now you have your center. I guess you do two things. So you either have an option for people that either you can't save their teeth or they're currently wearing a denture for a snap in, snap out, more affordable option, or they can get a fixed set of teeth on the upper and lower. Is that kind of how it works?
I'm super glad you asked me that question, Randy. This is one of the things that's changed dramatically. Is maybe somebody comes in and they're not ready to go for a full fixed set of teeth with a lot of dental implants. Now what we can do is, if they want to just stage it over time, they can come in and we can get them teeth, like literally in a few hours they can have teeth. Now these teeth might come in and out, they can remove them, but nobody else can. I mean, they're not going to come out on their own, they're not just going to fall out. They don't have the roof of the mouth covered. You know, with a denture you can't taste your food, Randy? Because because the palate, there's this little suction thing that covers up the roof of the mouth that has taste buds. So now you can't taste your food. It's no fun to chew with the denture. With the teeth I'm talking about, yeah, they can be removed, but they don't have to. They're not as bulky. They don't have this big roof of the mouth covered. So we give them a set of teeth, and if they want to upgrade down the road, Randy, they can upgrade to a set of teeth that stay in all the time. So we have this ability to take somebody with teeth that we just can't save, and they wouldn't want to save them anyway, and put them into a program where over time they can put the teeth in, and it's
so they're locked in, and they can still eat whatever they want.
They still eat whatever they want, but at a time in the future, if they decide they want to go to, like, listen, I'm going to go to fixed teeth, and I had this just happen just recently. A lady came in and she didn't know if she wanted permanent teeth. Okay, I hesitate to use permanent because a lot of people think permanent means, oh my gosh, they can never come out. I can never change them. If something's wrong, oh my gosh, what am I going to do? You can remove them. We can always remove them. And we can make changes to them and things like that. But the patient doesn't have to worry about taking them out. They can brush them in their mouth, and they don't have to take them out to clean them. But this transitional program that we have allows people to go from not having to skipping the denture part altogether. And the affordability is important. And Randy, that's another reason why people don't come to the dentist, is money. And money's an important thing to talk about.
And we mentioned, I mean, Medicare, Medicaid, even the best dental insurance doesn't cover the whole thing.
Yeah, but Randy, we have there's all kinds of different financing available.
People are financing
Oh
this?
my gosh, yes. And even people with some credit issues. So somebody who's had credit issues in the past. We work with 6 different companies to help people to make this affordable.
Now we're short on time.
Randy, I just have a few more photos.
Okay, a couple more
I
photos.
got to show you these.
I don't want to hurry you, but
listen. Take a look at this young lady.
All right.
This lady, the first time I met her, she was petrified. She wouldn't even open her mouth, Randy. She wouldn't smile. She wouldn't even let me look in. Her husband brought her, and she sat through the appointment with her mouth shut. I had to literally pry her mouth open to get a look. She has severe gagging problem. So she was not only did she not like her smile, again, and she couldn't chew, but she was petrified because she didn't like all this stuff in her mouth. She was afraid she was gonna, gag.
Right.
Oh, she gagged. You could just look at her and she would gag. So one of the real benefits of having the technology that we have now, we can take impressions digitally. We don't have to, all that stuff they put in your mouth to take impressions. A lot of times we don't even use that anymore.
It's like a wand kind of a thing?
We take a picture, a 3-dimensional picture. So that was important for her. That was a big thing for her.
And she would have had dentures.
She was headed straight to dentures, Randy. Her after picture shows what we did.
Nice.
Yeah, we were able to take the teeth out without gagging her. So look at the difference in her appearance.
Yeah.
She is so happy right now. Now when she comes in, she's all smiles. She wants to talk and interact. Whereas before, I couldn't even get a word out of her. That's the difference in somebody's life. So not only does she have a beautiful smile, but she can eat whatever she wants. So let's talk about a few more, okay?
Yeah.
Let's talk about this guy. This is a guy that was old beyond his time. He looks a lot older than he is, but he's not, and he's a happy guy too. But he doesn't look real happy in his first picture, does he? He was, again, with this person, really hard to get him to smile.
So that's his smile. Okay.
That's his smile. So you were saying earlier, you know how many people are walking around like there's thousands of people walking around like this, but that's how they smile. You can't see their teeth. So, and he's not an old guy, okay? Just because he starts looking old doesn't mean he's old. And he doesn't want to wear dentures, okay? But he's going to lose his teeth because he can't chew. So the very same thing. We place dental implants in a short period of time, about 4 or 5 hours. He ends up having a smile that you see right here. And then, look at him now. He looks like he
You're
looks
right.
like
He does look a lot
he
younger.
looks like himself again. He's back to himself.
And they look natural.
Oh, they're beautiful. And they're made out of a super, super strong material. Sometimes people are worried about, well, are they going to break? You might have a problem adapting to them. People, the way we're able to do this with guided surgery and everything being digital, I can show somebody ahead of time exactly what their smile is going to look like, and we can copy it. Here's another one, Randy. Another example. This gentleman was going to lose his teeth because he had gum disease and he lost a lot of bone. Super important. He had to have bone. And so he lost the bone, but this is what we can do. And this is a full set of teeth fixed on dental implants. They don't come in or out. Now he wanted that little gap between his 2 front teeth, and this just goes to show you we can actually make it look however they want. Wow. So we can customize it to however he wants. This young lady's about to get married. Super unhappy with her smile. We were able to remove the remaining teeth that were broken down, decayed, loose. She didn't have any teeth in the back. Give her a brand new set of teeth. This is her in a temporary.
Nice.
This is about 2 weeks after her surgery. She looks like that. Here's another one, Randy. Young gentleman right here. Unfortunately, just the decay had ravaged his teeth, and in a very short period of time, we were able to again give him a full set of teeth. Exactly what he always wanted, white straight teeth. Now he's got them. Here's another patient. She'd struggled for years with, we call it a flipper, something that comes in and out. She hated it. She's really unhappy with her smile. Her husband dragged her in.
Okay.
And she, we evaluated everything. It was going to be really difficult to try to save her teeth, so we went ahead and removed them. And let me just make a point here, Randy. She never left our office looking horrible. She never had to leave our office without teeth. A lot of people think they're going to have to leave the office without teeth. Never happens.
Okay.
We always have. No one's ever going to leave looking worse than when they came in the door. Not going to let that happen.
So this is done in one day,
That's done in about 4.5 hours.
and those upper and lower teeth don't come out.
They do not come out. They're fixed, and she doesn't ever have to take them out. She comes in to see us every 6 months. We take everything out, we clean them for her, and we put them back in. So look at what it's done to her appearance. Look at her smile.
Yeah,
Before it looks like just a super forced smile. Her smile is so natural now, and she can eat. So she's very happy about that. Here's a gentleman that had, this is a very sophisticated guy, a smart guy. And you know, I think he was just tired of having his teeth look the way that they looked. He really wanted a set of teeth that reflected who he was. Now he's got a great set of teeth. Again, this is implants attached, a full set of teeth attached to dental implants that don't have to be removed. So here's another patient, beautiful woman, but unfortunately her smile wasn't beautiful. Now look, she has to force that smile, another forced smile.
Wow.
So in one afternoon, she comes in like this, and she leaves looking like the after picture. She had been shamed her whole life about her teeth, but you can just see in the teeth themselves how different, how transforming that smile is from forced to natural.
Time for 2 more.
Okay, Randy, I got another one here. This is a gentleman that wore a denture. Man, he hated a denture. Again, couldn't taste food, flipping and flopping, had to wear gobs of that stuff. The adhesive, had to wear lots of that to even keep this in. And they look crooked. They just don't look right. Once we're able to remove the teeth, now he went from having the teeth that he has, and we did a transitional appliance for him. So he had something that he could still remove, but it stayed in. It wasn't going to move around. It wasn't going to move around or flop out or fly out at his kids or anything like that. And then he transitioned into something that stays in all the time. Here's another one. This young lady, again, a lifetime of just not good dental experiences, super afraid of going to the dentist. Finally, she was my patient for several years.
She was headed to a denture.
Yes,
Really?
headed to a denture, a young lady, but super afraid of the dentist. And finally, after a couple of years, it was time for her. And she knew it. So with her, she walks in with the teeth that she has right here in the before picture, and she walks out with brand new teeth. Brand new set of teeth.
We're out of time. Final message. Somebody watching this, they fit into one of the 2 categories. Either they have really bad teeth that are headed to dentures, but they don't want dentures, or the denture wearer. And they've heard what you had to say today, but for whatever reason, they're putting it off. Maybe they're afraid. What do you say to them?
Randy, I want these people to come in and see us. I really want them to come in. They come in for a free screening. Let us find out what you're a candidate for. There's no pressure. There's no commitment. We want to help you. So come in and let us give you a copy of our book. You can go on Amazon and buy our book, but come in and I'll give you a free copy.
Okay, so if they mention this show, give them a free book.
I'll give them a free book. This will give them the ability to ask the questions that are important to helping them to get to where they want to go. They come in, they can get the screening, we do the CT scan, we find out if they're a candidate, and then we can tell them, these are your options, and then help them move
financing,
forward.
you'll discuss financing.
Absolutely, absolutely. Everything they want to know is going to happen in that appointment.
All right, I want to thank you for coming on the show.
Good
stuff.
Thank you so much for having me, Randy. I really appreciate it.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.